Let's talk of ovarian endometriosis and endometrioma and the options for treatment, and especially in women who are trying to get pregnant. Now, ovarian endometriosis affects about 1 in 10 women of reproductive age and is often linked to pelvic pain and infertility. This review explains how different surgical options for ovarian endometriomas, are often called as chocolate cyst, filled with old blood, can relieve pain, but the choice of surgery must consider a patient's fertility goals and ovarian health. Now, what we do know is that removing this cyst is proven to reduce pain and may improve chances of natural pregnancy. But research, in fact, proves that removing cysts does not boost IVF success and it can, in fact, reduce ovarian reserve. That is, the number of eggs left behind in the ovaries. And this is because surgery may remove healthy ovarian tissue or cause scarring. Careful planning and preoperative fertility tests like AMH and anterior follicle content are advised. And that's what I usually say, that before you go in for any surgery, have your AMH test done and a scan to look at your follicle count. Those who want to have children in the future may review the options. Surgery may help in spontaneous conception, but it's not always the best before IVF. Those with low ovarian reserves or previous surgery may be at a higher risk of reduced fertility after the cyst is removed. Fertility preservation, such as egg freezing, embryo freezing, should be discussed in those women who are at a higher risk of losing their reserve. But that's something which needs to be discussed further. Which are the surgical techniques? Cystectomy, that's removal of the cyst, that's best for pain and lower recurrence, but can harm ovarian reserve, especially for larger and bilateral cysts. Drainage and electrocoagulation is less invasive, but has also, what do? You drain it and then you burn the base of the cyst, but this has a higher risk of recurrence and it does not relieve pain over a long period. CO2 laser ablation, promising for protecting ovarian tissue, but in fact, we need more studies. Alcohol sclerotherapy, again coming back, it was old. It may preserve eggs better, but recurrence rates are very high. And in some cases of IVF, some clinics have done that. Often a combined approach may be useful in preventing more of damage to the ovary. Finally, removing of the ovary is reserved for atypical cases and where fertility is not an option. One of the things also suggested is suturing the ovaries after surgery instead of using heterodiathermy preserves more ovarian tissue. But again, that depends on the skill of the surgeon. This review urges clinicians to use endometriosis fertility index and shared decision making to balance the risk. Surgery is not for everyone, and some women may do better freezing their eggs or embryos before they start any surgeries. So a key point is see what a woman wants. If she's planning to have children, then be more conservative and suggest egg freezing or embryo freezing. And that clear discussion is essential and important.